Okay, so we talked about taking and removing PPE. You've watched the video on breaking down and setting up a room. So the last component of the infection control course is going to be instrument processing. So I'm going to walk you through the process of all of the steps that we need to do and the critical pieces to instrument processing. So the first thing we're going to start with is emptying the sterilizer. So when we empty it, it's okay to have bare hands because it should be clean. And the outside part of the sterilizer should always be kept clean. If there was a breach or you accidentally touched it, just wipe it down. So I'm going to use the hand-based alcohol rub, or the alcohol-based hand rub, just to make sure my hands are clean. And we're going to unload the sterilizer. So when you unload it, this is cool. If it's hot, you can use a tool. But we always want to check the indicator. So on the back of the pouch, it should have changed color. So I'm looking at all of my packages, making sure my indicators change to the appropriate color. If not, it means that they may have not gone properly through the process and you would re-sterilize them. So all of these look good. Also, if you have multiple sterilizers, you may want to mark on there sterilizer 1 or 2 to indicate which sterilizer you used. Also note that in sterilization area, there should be a clean side and a dirty side, and it should have a natural flow from dirty to clean. Therefore, when you're emptying all of these instruments, you should obviously put them on the clean side. Just going to load this up. And that concludes how to unload the sterilizer. So checking the package to make sure the indicator changed, and also making sure that you keep the outside clean. So now I'm going to demonstrate instrument processing. So we're going to say, I just finished a procedure and I'm coming in with my tray. So if that's the case, you're going to have your full PPE on. So I'm going to go ahead and place the rest of my PPE. So as you remember, gown first, then mask, eyewear, and gloves. So when we're processing instruments and we're cleaning a room, we're not going to use exam gloves, remember? So we're going to use our utility gloves. You can use these without gloves underneath, but I prefer to have clean gloves underneath. So we'll have these guys on. And keep in mind, we just finished a procedure and I'm coming in with my dirty tray. So I'm never, ever, ever going to set my dirty tray on the clean side. So we'll start here. I'm going to place my instruments into the ultrasonic cleaner. And then we'll turn it on. Typically, the ultrasonic cleaner, you're going to run it for at least 10 to 20 minutes. The point of this is it vibrates all of the debris or anything dried on the instruments, and it's almost like a pre-clean. It's never a sterilization technique. It's never a disinfecting technique. It's just what we refer to as a pre-clean. So we'll say it's been 10 to 20 minutes. In that time, to process my tray, if it has a barrier on it, you can just shimmy it out of the barrier onto the clean side. But let's say there was a breach or something like that. You could always disinfect with a wipe, being sure that your gloves aren't touching the tray. So there's a barrier between my hand and the tray. I'm disinfecting it. And this is my pre-clean. I would do this 2 times to make sure that it's disinfected, because we pre-clean and then we disinfect. So I processed my tray. Now I'm going to do my instruments. You'll shake off the excess water and rinse the instruments. removing any of that solution. The key to this part is you always want to roll the basket away from you. Never ever towards you, because you don't want any instruments to fall on your foot or poke through your shoe, which you should be always wearing appropriate shoes so that doesn't happen to you anyway. Now that I've rinsed my instruments, I'll go ahead and separate them, and I'll bag them. So since this is the dirty side, not clean, you can touch it with your gloves. These are all considered contaminated, so it's okay to just grab your bags there, or whatever process they have in your office. You're going to place the instruments into the pouch. When sealing the pouch, it should never be sealed like this or all the way down here. There is an appropriate line to where you seal your pouch. So you're going to seal your pouch on the appropriate line. At this point, you can mark which sterilizer you're going to be putting it in, if you know. And also, you want to stamp or write the date. The reason for writing the date on the package would be if you had a spore test fail, we want to know which instruments to pull that may possibly be contaminated. So I will load up my packages, making sure to fold them correctly. And we will load our sterilizer. So now we're going to load the sterilizer. I can't touch this because these gloves are contaminated, so I can remove it. I have my clean glove underneath, and you can open it because this is clean. It hasn't touched anything. So we are going to load our instruments paper side down, and I'm touching this part with my dirty glove, but that's okay. It's going to go inside of the sterilizer. The key is to keep the outside clean so that when we unload it, there's no cross-contamination. I'll close this, clean hand, and then I will start my sterilizer. Anytime before you start a sterilizer, you always want to check the water level to make sure it has enough water if it's steam. With the Statim, we'll learn this one in class as far as how to operate this machine, but this is also another kind of sterilizer. So I will start my cycle and let it run its course. So the things to remember: always make sure when they come out you're checking the indicator pouch. If you see here, the indicator is blue. When they come out, they'll turn a dark blue. And we also have something that's called the integrator. And this you will see on the test, and you'll come across this in practice. So an integrator and an indicator are two different things. The indicator tells us if it has gone through the process. The integrator will tell us if sterilization has occurred. So although this is telling us sterilization has occurred, it's important to use an integrator and a weekly spore test to ensure your instruments are being properly sterilized. So I'll see you in class, and we'll perform this skill.